Rahim. Our seminar, our seminar today is about ear anatomy. We will start by the parts of the ear. Ear is composed of the external ear, middle ear, and the inner ear. External ear is composed of the pinna, which is the visible part of the visible auricle, and the external auditory meatus. External auditory meatus is about 3.5 cm. Outer part of it is cartilaginous part, outer third, and the inner third is a bony part, and it ends with the tympanic membrane. By talking about the middle ear is a cavity, is a box-like cavity. It starts laterally by the tympanic membrane, which is attached to a tiny spur of bone called the scutum. It is an important part. It is an important part because any pathology can cause an erosion to this part, and distribution of the disease can be seen through, just like cholesteatoma or any infection. The middle ear cavity or the tympanic cavity, it is divided into upper part. It is divided according to the levels of the tympanic membrane. Above the tympanic membrane, it is an important upper part of the cavity called the epitympanic recess or the attic. The attic, it is a part, it is a superior part of the tympanic cavity, which is recessed superiorly, leaving a tiny plate of bone. It is called the tegmen tympani. The tegmen tympani, this is the tegmen tympani. ما ادري المؤشر ده يشتغل. This is okay. This is the tegmen tympani. It is an important part because any pathology can erode this thin plate of bone, and connection will occur to the middle cranial fossa. Middle ear cavity, as we said, it is a box-like cavity. Its floor, its floor will separate. Its floor will separate the cavity from the bulb of the jugular vein. The lateral wall is the tympanic membrane. It is not visible in this picture, and the anterior wall will opens the Ostechine tube. Posterior wall of the posterior wall, especially the upper part of the posterior wall, or as we mentioned, the attic or the epitympanic recess, contains in its upper part an opening. It is called the additus ad intrum. The additus ad intrum opens or communicates the cavity with the mastoid ear cells, and any pathological process will separate from the cavity into the mastoid ear cells. While what we have else is the medial wall, which is the lateral wall of the inner ear. It has 3 prominences and 2 windows. The large prominence is the promontory for the cochlea, and in the upper and posterior part is the prominence for the lateral semicircular canal, and between them is the prominence for the facial canal through which the facial nerve passes. What else? What we have else is the ossicles. The ossicles, we have three bones, اللي هي malus and incus and stapes. Malus attached to the tympanic, malus attached to the tympanic membrane, and then it goes upward. In the attic, the malus have a joint or will articulate with the incus, forming the incomalus joint, and then the incus have a process inferior. It's a process goes inferiorly to articulate with the stapes, which is attached to the oval window. And then we have the inner ear. The inner ear have a bony labyrinth and membranous labyrinth. It is a fluid-filled sacs hosted in a protective labyrinth of dense bone. The bony labyrinth. The bony labyrinth is composed of a vestibule, which is located in the center, communicated with the semicircular canals posteriorly and the cochlea anteriorly. lateral semicircular canal. Lateral semicircular canal bulges, as we said, in the middle ear. And when we were talking about the middle ear, bulges into the lateral wall of the middle ear, and the same on the same time the medial wall of the middle ear. While the superior semicircular canal prominences superiorly into the bone, forming the arcuate eminence in the vitreous bone. In the inner ear, we have two ducts. A simple duct, which is the cochlear aqueduct, and a more complex duct, which is the vestibular aqueduct, both of which opens in the posterior fossa. The vestibular aqueduct opens in the midway between the internal auditory meatus and the groove for the jugular vein, while the cochlear aqueduct opens inferiorly, just parallel to the internal auditory meatus. In the vestibular aqueduct, there is another duct, اللي هي internal duct. The internal duct starts by the junction between the saccule. We will talk about the membranous labyrinth later, which is the saccule, the junction between them, forming the internal duct, اللي هي endolymphatic duct, and ends blindly in the endolymphatic sac. Now we are talking about the membranous labyrinth. Membranous labyrinth composed of the auricle and the saccule. Auricle is connected to the semicircular canals, and the saccule connected to the cochlea. Between them, there is, as we said, the utricosaccular duct connects between them. And then the endolymphatic duct and the endolymphatic sac. Endolymphatic duct starts from the junction between the utricle and the saccule. Starts the endolymphatic sac and ended blindly with the endolymphatic sac. It contains the endolymph. While what surrounded that canal is the perilymph. The perilymph in the vestibulocochlear aqueduct, continues with the CSF. And then we are talking about the cochlea. The cochlea has about between 2.5 and 2 3/4 The cochlea has a two and a half or 2 and 3/4 turns, and its apex points anterolaterally, so that the axis of the cochlea is perpendicular to the axis of the vitreous bone. Internal auditory meatus. An internal auditory meatus, it is about 1 cm of bony canal. It contains the facial nerve and vestibulocochlear nerve. There is a piece of bone which is called the crista falciformis. Crest. It is a crest of bone, divides the canal into upper and lower compartments. The upper compartment, it is clarified by this diagram. The upper compartment has the superior vestibular branch of the 8th cranial nerve and the facial nerve, while the lower part has the inferior vestibular branch and the acoustic branch of the vestibulocochlear nerve. The facial nerve, it has 4 parts. The first part, it passes in the facial nerve has 4 parts. The first part through its the internal auditory meatus. The second part is an important part. It goes anteriorly, then lateral, then goes posteriorly. It turns around the cochlea, forming a U-band. This U-band called the geno. And then the third and fourth part goes in the facial canal, as we said, in the middle, in our talking about the middle ear. Development of the ear. The external and middle ear is developed from the first and second branchial arches, while the inner ear develops from the otic capsule. Radiology of the middle and inner ear. The plain film. We have a plain film, CT scan, and the MRI. Plain film is generally replaced by the CT scan and the MRI, so it has no big role in the diagnosis. But we can see the internal auditory canal, semicircular canals, and the vestibule, as we see in this picture. سيتي سكان هذا استاذ، هذا السيتي سكان مجموعه صور، هو فحص واحد. انا كنت يعني اتمنى اقدر اجيبه كله فحص كانه ورك ستيشن واحد يقلب به، بس ما رحمت. فيعني اختارينا الصور حتى بس نوضح قدر الامكان اللي ممكن. From the upper part, the upper sections, this is the axial CT scan. From the upper part, when we starting to go downward, the superior semicircular canal will start to appear as bony defects anteriorly and superiorly. فنقول anterior limb of the superior semicircular canal will posterior limb, and then we will start to go downward. فهنا هذا البوني defects. This is the bony defects of the anterior and superior, anterior and posterior limb of the superior semicircular canal. When we are going downward, this is the defects, and then we will start to see the posterior semicircular canal. Then we are going downward, we will see the internal auditory meatus and the facial nerve بالlabyrinthine segments of it. Then we are going downward in the segments. Here we will start to see the cochlea. This is the cochlea with turns of the cochlea, and this is the cochlear aqueduct. Of course, the posterior semicircular canal, we are going to, and we can see the posterior semicircular canal, and here the tiny part, here the vestibule. In the middle ear, we will discuss the middle ear later. Here we are seeing now we will talk about the middle ear, radiology of the CT scan of the middle ear. This is the upper part. This is the upper part of the middle ear. What we were talking, what we named it attic or epitympanic recess. It is an important, as we said, and this part is the additus and antrum, which connects the middle ear cavity with the mastoid ear cells. Also here we are seeing the bones of the ossicles of the middle ear. We are seeing as we are in the higher level in the attic, so we will see the malus and the incus joining together or articulating together with the inquidomalus joint. Going downward, we are seeing the bones. The bones begin to separate between them. In this sections, we are seeing the clearly the malus and the incus. The malus are going outward, the incus are going inward and posteriorly to start to articulate. This is very clearly the malus and the incus, the malus and the incus and the stapes, where the incus start to articulate with the stapes and the stapes joining or attached to the oval window. Here is the external auditory meatus, the medial part of the external auditory meatus. MRI. In the MRI, we will see better, more detailed pictures. We are going to see the nerves and its courses. This is an axial T2 MRI to show the internal auditory meatus and its contained nerves. Number one, we are seeing the cochlea. Here is the cochlea. Number two, the vestibulocochlear nerve here, and the facial nerve, number three, and number four. This is the basilar artery. Well, five, we are seeing the cerebellopontine angle cistern. And by this, we are completing our lecture.
شكرا دكتور ابراهيم. بس انتوا هاي واحد عنده سؤال قبل ما نروح؟ ماكو. يلا نمبر 1 سالي.
cochlear duct.
cochlear duct. نمبر 2 علي شبر.
نعم أستاذ، هاي superior semicircular canal.
superior semicircular. نمبر 3 هاجر.
Doctor, this is the posterior semicircular canal.
posterior semicircular.
Semicircular canal.
متى تطلع الإجابات مالتك؟
اي نعم.
3 posterior semicircular canal.
أستاذ
إبراهيم.
أنا دا أستعمل البي دي إف بصراحة. الإجابات كانت تطلع بالأنيميشن بالباوربوينت، فما تطلع بالبي دي إف بصراحة.
أوكي. هبة مهدي، بس أنت تقول صح أو غلط حتى.
أوكي أنا ويا الزملاء
البعض.
لا صحيح، هسه كل الكلام صحيح.
إيه، هبة مهدي نمبر
نعم
4.
أستاذ. lateral semicircular canal.
lateral semicircular canal.
صحيح.
داليا باسم نمبر 5. هاي بسيطة، ديك اللاترال هاي الميديا.
نمبر 5 الأوتريكا.
نمبر 5 أوتريكا.
أوتريكال أستاذ.
أوكي. أسماء معين نمبر 6.
دكتور endolymphatic duct.
endolymphatic duct. وراها ميس زهير نمبر 7.
Atricularissacular duct.
صحيح.
secular duct. أوكي. نور شاكر نمبر 8. ساكيول.
صحيح.
نور محمد نمبر 9.
نعم دكتور.
نمبر 9
internal auditory meatus.
internal auditory meatus.
صحيح.
اكو بعد لو هاي خلصت؟
لا خلاص أستاذ هاي هي.
عندك بعد شو اسمه لو بس هاي؟
لا انتهى. ثانك يو.
انتهى.